And on that note, we actually have a special guest today, taking time out of what I can imagine is an incredibly busy day. Congresswoman Jen Kiggans, representative for the 2nd District here in Virginia, joins us now on Live Impact News. Congresswoman, I do not believe we've been able to meet. I am Connor Reel. Thanks so much for taking the time to join us here.
Yeah, thanks for having me today.
Absolutely. And, I know that everybody is back in Washington, D.C. There will be votes tonight on this funding compromise. I, of course, want to start there. The end of this government shutdown appears to be in sight, which I'm sure will be a relief to many Americans. But that funding compromise comes without the extension to the Affordable Care Act tax credits that have been championed by Democrats, and something that you have been vocal about. A letter that you wrote with other members of Congress said, noted how important those are to maintain health coverage for millions of Americans. This funding compromise does not include extensions for those premium tax credits. Are you concerned about the health care for those millions of Americans as we push through a funding compromise without those extensions?
Yeah, I find the messaging coming out of the Democratic conference to be it's offensive and contradictory and just very off-putting and personally offensive to me as a nurse practitioner. I will say that we need healthcare reform to be put in place, but the Democrats have held us hostage for 42 days, and we have been not able to do our work here in Congress. We have not been able to be here in person to have regular legislative order. And to what effect? What have they gained? They have gained nothing. I mean, the CR that was passed in the Senate requires a vote, and I look forward to that vote because we do need to be having these healthcare discussions. But aside from there's 3 appropriations bills in there, it extends our funding deadline to January 30th. But we need to be here in person, and the fact that we were shut down for 42 days so that the Democrats in the Senate could play ridiculous political games has been wrong. And we certainly need to do better than that, and we need to have these healthcare discussions. So let me grab my earpiece. I'm not sure. Can you tell me where that went?
No problem.
I can hear you, but we need to get back to regular order for sure.
Absolutely. If anyone can relate to a faulty earpiece, it's us here in the media. So I completely understand always trying to get that IFB right. Now, we talk about the 42 days and how Senate Democrats have kept the government from being reopened. I want to ask, and I want to find the right way to frame this. Their message has been that they are not voting through these funding bills because they want to force extensions to those premium tax credits. If their party feels as though this is the only way they can meaningfully get health care for millions of Americans on the table, is that something that you can relate to from a negotiation leverage standpoint?
Yeah, so we introduced, my name is on a bill that introduced this issue, this premium tax credit issue in the beginning of September, so before the government shutdown. So I don't care if the government is shut down or open. We need to be having these discussions, and there's got to be a better solution than Obamacare, which is very expensive. But the premium tax credit issue, these are COVID-era leftover tax credits that were set to expire, that the Biden administration, when they put them in place, set them to expire at the end of this year. So my concern is that people's health insurance premiums will go up unexpectedly at the end of the calendar year. As a nurse practitioner, I want people to have affordable and accessible health care. So we introduced a 1-year extension of these premium tax credits to give Republicans and Democrats time to come together to have these discussions. The fact that the Senate Democrats chose to create chaos for 42 days to prevent us from even being in Washington was wrong, and now we're up against a compressed timeline. This bill has great bipartisan support. We've got 14 Democrats, 14 Republicans. I would love to see either my bill or a version of my bill that provides a longer runway for these premium tax credits to exist. We need to be having those discussions, but I couldn't do that when the government was shut down. So now that we're back, we can have these discussions. Happy to put that to talk about healthcare because I need people out there to be able to receive affordable and accessible care.
And now that you guys are back, now that the government is on the brink of reopening, but we do have this compressed timeline, what can you do specifically to ensure that your bill or another like it does pass in order to protect that healthcare coverage?
Yeah, we'll certainly have discussions with leadership. It's one of the things that we've been doing. We've written a letter to Speaker Johnson. We had, almost 13, I think, Republicans get on a letter to just emphasize how important this is and that the calendar clock is ticking. And for some reason, Congress has trouble getting its work done on time. So because we know that the end of December is next month, I just want to give us a runway. I think we can put reasonable changes in place. We did it with Medicaid reform; those were important discussions, but we had them for almost a year leading up to reconciliation. And as a healthcare provider, I had a seat at that table. And as a district, Virginia is a Medicaid expansion state. I have plenty of patients that receive Medicaid. I have patients that are on Obamacare or Marketplace Healthcare. I have fellow nurses that are on ACA healthcare plans. So I care about them, but I also understand what those challenges look like, not just for patients, but for providers. And I think that we need to have more transparency when it comes to healthcare costs. So we need to provide some competition for health insurers. So there's a better way to do healthcare, but I couldn't be here in Washington and having those hearings, those committee meetings, because the Senate Democrats chose to shut down the government. And that was wrong. They held us hostage. They held the federal workers' paychecks, my military families who are anxious about their paychecks. Our Border Patrol, our federal law enforcement, our air traffic controllers, they held all of those people's paychecks hostage under the guise of just wanting to have healthcare discussions, which we were happy to have any day of the week. So it's been a very frustrating period, but we're certainly happy to be back here in Washington and ready to get back to legislative work.
And when it comes to that government shutdown, and you speak about how so many American people had their paychecks withheld, and the suffering only grew as the days stretched on of this shutdown, something that I have heard floated about as a means to prevent something like this in the future is if members of Congress were to have their paychecks withheld during any future government shutdowns. Is that something that you would support and that you think could be effective in preventing another situation like this?
Yeah, absolutely. We requested that our pay be held, as did many members of Congress, many Republican members of Congress. I don't know if any senators did, but that's certainly one way to address this problem. Yes, our staff didn't get paid. All the federal workers didn't get paid. So members of Congress shouldn't get paid. I think we should stay here and have our August recess withheld until we can get our appropriations bills passed. There's no reason that Congress can't do a better job of passing things on time. I served for 3 years in the state Senate in Virginia. We have a budget that we pass every other year. We also don't spend more than we take in. There's some lessons to be learned from our state house in Virginia, but we can get these bills done on time, and we should. And now we have 3 appropriations bills that will come with this continuing resolution out of the Senate. But there's 12 in total. We have 9 more to go, so there's certainly work to do. But it's important for us to be back so we can get that done.
And I sat in a panel not long ago with yourself, Bobby Scott, Rob Whitman, and Jennifer McClellan, where you guys spoke about, I think, a monthly lunch where you get together and you talk about the issues that face Virginia and how you look to work together despite your differences to solve problems. I think for a lot of regular Americans watching this shutdown stretch on, even whether you want to blame either side, it's clear that in Congress, that level of cooperation does not exist right now. Why is the cooperation that we have here in Virginia between our representatives not able to translate to the federal level on a whole?
Yeah, well, you saw that we just lived through a contentious election cycle also. And then you saw a clip of, Senator Kaine was asked by a reporter in the hallway, what he thought about healthcare. So I've been too busy focused on the Virginia elections. And oh, by the way, the chaos that the Senate Democrats created. Well, that chaos impacted people's paychecks. So of course that had an impact on our elections that we just had here in Virginia, which were disappointing to say the least. So, it's all tied together, and it's a game. It's a game that the Democrats have been playing. They've played it before, and they played it again. And that's not why people like me ran for Congress. I ran for Congress as a military veteran, as a Navy spouse, as a Navy mom, as a person who understands healthcare, who has 4 children that I'm trying to raise in a very complicated and complex world. I care about keeping our families safe. I did not run for office to play political games. And we see this time and time again coming out of the Democratic Party, and then this fear mongering and these talking points. And it is wrong, and it created a hostage situation for 42 days. And it has to stop. So thank goodness we are here in Washington. We can't wait to reopen the government and to get back to work to doing the good things that we were elected to, like the Working Families Tax Plan that you saw come out of our reconciliation work this summer, so that we know that people care about having more money in their bank accounts, their paychecks, and that tax extension we gave them, the no tax on tips and overtime, the doubling of the child tax credit. There were some really good things in that legislation, the $150 billion Defense Plus up, which we will feel in Hampton Roads. There are the border security pieces. These are the reasons why the American people came out last November and voted for this change. And we are continuing to give it to them. And I don't need the distractions and the chaos that the Democrats continue to cause. It impedes our work.